Now, a lot of people have asked, which one is better? Is PRP better than GFC, or is GFC better than PRP? In the modern world of regenerative medicine, two therapies have really gained mileage in recent years. One being PRP, which stands for platelet-rich plasma. The other one being GFC, which stands for growth factor concentrates. Now, what is PRP? PRP is a form of regenerative medicine where we draw a certain amount of your own blood, we separate it through titration, and then we spin it in a centrifuge. And like the name suggests, we get the plasma that is rich in platelets. Why do we use PRP? We use PRP to regenerate skin tissue because PRP is a vasodilator and it accelerates multiplication of tissue because of the high concentration of growth factors. If you go a little earlier into the history of PRP, you will see that orthopedics have used PRP to help athletes in healing of joints when they have issues with their knees, when they have issues with their shoulders. And most recently, now we're using PRP to renew the skin, where people are using it for their face to help in collagen renewal, to even out the skin tone, to tighten lines in a very natural way. But as well, we're using it in hair restoration, where people are going through hair thinning, in ensuring that we stop hair follicles from miniaturization, or what we would call shrinking, for those people who are going through genetic form of hair loss. We've used PRP post-hair transplant to optimize the performance of the follicles that have been grafted into new areas. But then PRP remains to be the first generation when you compare it to GFC, which is a growth factor concentrate. GFC is actually a lab development that has enhanced the way we prepare PRP, and manufacturers have come up with these tubes that have a special gel that actually harvests the growth factors from the platelets. So it really becomes a second generation. PRP being first generation, GFC is the second generation of preparation of PRP. So it becomes easier for the cells receptors to really pick up the growth factors. At the same time, it is a much pure preparation, and because of that, then it makes it easier for the cells to benefit from that. When you look at PRP and GFC, the difference is really in preparation. We have an advancement of how we prepare PRP. Here at HairHub, we basically use PRP on your face, or we use GFC on your face when we want to take away lines, when we want to even out the skin tone. But also, we use it when we want to accelerate hair growth or post-hair transplant, or where patients are going through male pattern baldness or female pattern thinning. We use that to really give a boost to the follicles that are struggling, to the follicles that are thinning out, essentially to try and give them impetus so that they can perform optimally. Now, a lot of people have asked, which one is better? Is PRP better than GFC, or is GFC better than PRP? Now, there are a number of things to consider here before you just jump out and say one is better. I think you're looking at PRP as a first generation, that this is the original way that we looked at getting our growth factors. But there are a little bit of advantages when you come to GFC because it is prepared in the technology that is there to harness the growth factors from the platelets. So when you deposit it, you expect to get a little faster results. But that does not indicate that then PRP is not good enough. It just means that PRP will take a little longer than GFC to deliver the same value or the same quality of result that you'll be looking at. The only other thing is that when you're drawing blood for PRP, whatever you will achieve with 60 mils of whole blood is the same thing that you will achieve with 20 mils of whole bloods of GFC. So yes, GFC makes it easier. You need less blood. It's easier for the cells of the body to really harness the growth factors. Hence, within 3 to 4 sessions, you'll be able to get good results. With PRP, you need at least 4 sessions for you to really be able to see good results of using PRP. Having said that, it doesn't necessarily mean one is very superior compared to the other. It just means that one is an advancement of the other, and it should be able to help you to achieve different things that you want to achieve. Now, when we talk about PRP or GFC, if you want to get these two therapies used on your scalp, maybe for hair restoration, the key thing you have to establish is that what is the diagnosis of your hair loss? What is causing your hair to fall off? If it is something that is killing your hair follicles or decimating your hair follicles, then you have to address that first before then you use PRP or GFC to help with generation of more hair. If it is post-hair transplant, then you want to make sure that you've grafted hair follicles. Then you use PRP or GFC to help with healing of the area that you worked on or even the donor area. and accelerate acceptability of the follicles that you put in place, and then supporting them so that they can start producing follicles as soon as possible. I just did this video to really introduce GFC, which is something that we've been doing at the clinic. We've seen very good results, but I must mention that this is actually our 13th year of doing PRP in the clinic, and we've seen unbelievable results. Not to say that this is a magic therapy. There are people who respond very well to it. There are people who will not respond very well to it. But then in the last year, we've been using both GFC and PRP, and the results are equally good. It's only that it's much easier for us to prepare GFC. It's more accurate because of the use of technology that helps the special gels that really help to harness the growth factors from the platelets, and it makes it easier. We draw less blood. When we are using jet pill to deposit, it's much easier. And for those people who go for the injection, the fluid that you're actually injecting back is refined compared to platelets, which would have bigger molecules, hence making it a little bit painful when you're squeezing in or you're pushing in tissue into the blood. I'm excited to continue sharing information with you, so see you in the next video.